In this video, I will be giving you some simple acupressure protocols for dealing with fever. What you would need is a black sketch pen of good quality, some clothes clips, a few chana seeds, black chana, a few seeds of fenugreek or methi, and a paper tape, a 1-inch paper tape and a 1/2-inch paper tape. So I'll be giving you a couple of protocols so you can use all of them or of any of them, and the fever will normally come down after a few hours. So the first thing is, when anybody has fever, the mistake we make is we rub the body with cold water, right? What happens is, if the fever is high, the sudden drop in temperature can cause convulsions. So instead of wiping with ice cold water or water from the refrigerator, just keep wiping the face, forehead, and the body with either normal water or lukewarm water. Okay, take a cloth, dip it in hot water, and then wipe the body. So don't use ice cold water because it can lead to seizures. Now let's look at the first protocol as suggested by Dr. Devendra Vohra. So what you would do is, you would be using clothes clips, okay? And make sure that this clip has a soft padding, and on the thumb in your left hand, just put the clips like this. 1, 2, 3, and 1 here at the joint. Can you see? Just put it like this. So use a clip of good quality so that the pressure is not too high and it has a soft padding. And now take a tape and tape your index finger and middle finger together. One tape at the top joint and another tape at the middle joint. Completely tape it round completely. Okay, so this is what you will do, and this taping you put it on your right and left hand, both the hands you put the tape. Okay, similar tapes you put in this. The clips you can put it only on the left hand. Okay, now leave this for a minute. After a minute, you'll feel a pressure. Take out the clips. This band you can leave. Now that I have removed the clips, I will show you how you can put the band on your right hand too, like this, and also on the middle joint. Okay, so we are done. So this you can leave for some time, and the clips you remove it, and then again put on the clips after 15 minutes, for a minute or so, again leave it and keep repeating. And in 2-3 hours, the fever will come down. So you can give the patient hot water or warm water to drink, and make sure the patient lies down, and you just cover the patient with a light cotton cloth. Okay, so this is the first protocol, and it's quite useful in quite a lot of cases. Now, the second protocol I will show you. You can use color. So with children, if the clip causes a lot of pressure, instead of putting the clip, you can just press the thumb. Like this. Apply good pressure and at this point. So adults can use the clips, no problem. Okay. So the second protocol uses color. Very simple. Take a black sketch pen. And start a line from the middle of your ring finger and middle finger from the center, and draw a line right to the bottom of the palm, like this. Okay. And again from here, draw it to the thumb, like this. Can you see? So from the center of the ring finger and middle finger, draw a line and then take it up towards the thumb. This is a Chinese meridian, which is called as the CV meridian. And you put it with black sketch pen. Make sure you use a good sketch pen so that you don't have any allergies. Put it on both the hands. So we'll see, we'll do it on the right hand also. And if you feel, when you put it on the right hand, you have to use your left. So you can take somebody's help to draw it. So you see, I have drawn. You can draw a slightly thicker line on both the hands, black. Along with this, on the left hand, index finger, okay? So in our finger, we have 3 joints, top, middle, and bottom. So in Ayurvedic acupressure, this is called as the Vat joint, and the middle one is called as the Pitta joint, and the bottom is called as the Kapha joint. And these pads in between, these are called as the phalanges of the finger. So this is called as the Vat phalange, the Pitta phalange, and the Kapha phalange. So along with these 2 black lines, you also put a circle of maybe a 1 centimeter diameter on both the Vat and Pitta phalanges of the left hand ring finger. So this is your complete protocol for you. This works very well for children. This works very well for children. Okay. So now we will see a few protocols with seeds. Okay. What you would do is you take a tape and you can just put methi seeds on a book or on any plain sheet, and then just stick the tape and it gets stuck. Okay. So this is how you prepare methi strips. So now what you do is you take the index finger of both the hands and you put a methi strip around it like a ring. This is the first seed you will apply. Index finger of both the hands. Index finger of both the hands. Next, index finger of both the hands in all the 3 phalanges. Phalanges is the center portion in between the joint lines. You put a chana. You can also put a matar. So take a slightly the 1-inch tape and stick a chana seed like this. And this you will put in all the 3 phalanges. So 1 here and 1 at the center phalange and 1 at the bottom phalange. 1 at the bottom phalange. Similarly, on the right hand, index finger, top, middle, and bottom. Top, middle, and bottom. This is one protocol. So what do we do? In both the index fingers, around the Vat joint, you put a methi ring. And in all the 3 phalanges, we put 1 chana seed. We put 1 chana seed. Okay. So this is another protocol. Now, you can easily put this for any age, for children, adults, everybody. And seeds work very well. So normally when you use seeds, you should leave it on for about 3 to 4 hours and make sure the seeds don't get wet, because the seeds have life in them. And if you wet it, the energy is lost. Okay. And then if you want to do some activity like eating or something, remove the seed, finish the activity, and again you put it. Now, when it comes to very small children, okay, what you can do is, again, you can use color. Both the index fingers, the pith joint here. Okay, pith joint is the center joint. Put a black ring around. Put a black ring around. Okay, both the index fingers completely you put a black ring, and in the thumb, in the bottom, you can put a black ring completely. So very safely you can use these colors for children. Okay, it will work very well. There are many cases where it has really helped. Now, sometimes what happens for kids especially, or even adults, when you have fever, the fever is accompanied with sometimes a mild kind of a convulsion. Okay. So what you can do here is, we will put a few seeds. We'll again put a few seeds. So just take one methi seed and don't doubt the strength of a common methi seed. It has got a lot of potential to heal because it has life and energy. Okay. So make a few strips like this with one seed, and I will show you the points where you will put it. So one is here. That is in the center of your thumb at the, where the bone here, you can see the bone here. So there on top, you put it. So this is a Chinese acupressure point. It's called as GV14 here. Similarly, on the other thumb. Okay. Next, you have one more point. See, I'm just putting one methi seed. That's all. So you have your middle finger, okay, the side towards the ring finger, just below your nail, put a seed. You need not have a lot of accuracy because the seed has got an area and it will cover. Just see, below the nail. Similarly, on the right hand. So you take the middle finger towards the ring finger. Okay. So the point below the nail. I have put the seed here. Okay. And one more point is on your index finger. On your index finger. So you see the top joint, the side towards the middle finger, put a seed in line with the nail, edge here. Can you see? This is the nail edge and this is the top joint. So we put a seed there. Similarly, on the other side, the index finger. So from the nail, you just bring your hand down and where it touches the top joint, you put a seed. Right? So these are 3 points. So one here at the bottom of the thumb, at the bone, and one here on the index finger. Just draw a line from the nail and then where it meets the top joint. Similarly, on both the hands. So these points are useful when the fever is accompanied with fits. Now, sometimes, especially women, are prone to get repeated fevers because of urinary tract infections. So when you have urinary tract infection, what you would do is, again, take a methi strip, and your middle finger, Wat joint is the top joint. So let us put a ring. I put a ring. On the middle finger, Wat joint, I put a ring of methi. And index finger, pith joint. We put another ring. Index finger with joint. So you see, where have I put the rings? On the top joint of the middle finger and the middle joint of the index finger. So this will help if your fever is due to urinary tract infection. So now I have given you a number of protocols. You can use all of them together, no problem, or you can use some of them and see what works for you. And for children, I would specially advise color. It works very well for the children. Thank you.